Inoperable. That is how the bill before us today has been described, as inoperable. In this chamber we see a bill, and we often see in black and white. But Mr. Acting President, after hearing from the witnesses before the Select Committee, this chamber referred this bill to, it is hard not to see the many, many faces that the child protection system has let down. It is a stark reminder of what is at stake if we get this wrong. Mr. Acting President, this is not just any bill. This bill gives us as a parliament the very rare but the very real opportunity to make a meaningful impact on the lives of so many vulnerable South Australian children. To make a meaningful impact on the carers who so passionately advocate for the children in their care, who at times feel that they have a mountain to climb within the department just to be able to protect and advocate for the child that's in their care. As a parliament, we have the opportunity to give these little humans a voice in this big, scary system that impacts them more than anybody else. We have the opportunity to encourage the early intervention and prevention that stops families from getting to that pointy end where children need to be removed, and to ensure the department has done everything in their power to do all that they can before a child is removed from a family. We have the opportunity to encourage the reunification of families where it is safe to do so. But we only do this if we get this right. And heaven forbid if we get this wrong. To read from the co-signed letter from South Australia's Guardian for Children and Young People, Commissioner for Aboriginal Children and Young People, and the Commissioner for Children and Young People, they say, our advice is the bill is not ready and it is not aligned with the commitments and objectives articulated within. It will not create the meaningful change that children and young people need. And there are parts which will cause new harms. The bill, in its current form, does not serve the best interests of children and young people. It will be ineffective to turn the tide on the overrepresentation of Aboriginal children and young people in care. It is inconsistent with the United Nations Convention on the Rights of the Child, the United Nations Declaration on the Rights of Indigenous Peoples, and the United Nations Convention on the Rights of Persons with Disabilities, end quote. Despite these concerns, and the many concerns of others in the child protection sector, the government indicated late last Thursday afternoon that it intended to pass this bill this week. Notably, this bill was listed as the first item on their agenda. The Select Committee established to review this legislation only finished hearing from witnesses roughly around 5 p.m. last Wednesday afternoon and reported back to the Parliament on Tuesday of this week. Now, I appreciate the ministers now indicated that they only intend to progress to Clause 1 today, but their priority letter that was sent out last week was listed to complete all stages by the end of sitting today and have this legislation listed as their number one priority. From the outside looking in, this does not appear to be a timeline of a government who is actively listening and taking on board the feedback of the sector. This government sat on the report for the review of the Act since February 2023 and only introduced the bill before us in October of 2024, roughly around 20 months after the report for the review of the Act. Yet somehow this government has been able to consider the work of the Parliamentary Committee in less than the span of a week. This Parliamentary Committee received over 50 submissions. They, for the most part, were not short submissions either. Each of these submissions had been formulated with great consideration and contemplation of the bill before us and the system more broadly. Most, if not all, of these submissions included numerous recommendations on ways in which this legislation could be improved and highlighted ways in which this legislation was lacking. My point in sharing this is that to actually consider the submissions and whether each and every proposed amendment in the submissions should be brought would have been, I would have thought, something the government could not adequately do in the span of 24 hours. Now, Acting President, I say 24 hours because that is roughly how long it was between the conclusion of the committee's final witness and hearing and the government indicating that they planned to take this legislation to a vote this week with its number one priority. The government took roughly around 20 months to produce legislation after the report for the review of the Act. Yet they want to pass this legislation the same week the committee reports back. Somehow this government thinks it is good practice, good governance, and a good way to legislate by ramming through highly complex legislation the week after the Select Committee concludes hearing evidence. We've been told as an opposition and as a committee, time and time again, that the consultation this government has undertaken is lacking, that stakeholders feel that their voices have not been heard in this process. Importantly, we have heard from many stakeholders that this legislation in its current form should not be supported and that there are many changes that need to be made. We have been given a long list of different changes stakeholders would like to see made to this flawed legislation. A list that, quite frankly, cannot properly be considered, nor the amendments drafted and consulted on to meet this government's rushed timeline. It is not good practice to turn a piece of flawed legislation into a patchwork quilt of rushed amendments in an attempt to put lipstick on a pig to meet this government's rush to ram this legislation through. Sound policy reform involves broad consultation, something that this government's rush timeline does not allow for. I find it interesting that the Minister has said that she will consider amendments that are put forward to this bill. Respectfully, Minister, it is the government's job to listen to stakeholders and to consult on this legislation before it was brought to this Parliament. Instead, the Minister has decided to outsource her job to the crossbench and to the opposition rather than taking the time to consider what stakeholders are asking the government for. Rushing amendments to a flawed piece of legislation does not remedy the inherent issues, it only perpetuates them. When we rush through amendments without thorough review, consultation and debate of these amendments, we risk entrenching errors that could have long-lasting and unforeseen, unintended consequences for South Australia's most vulnerable children and families. It is imperative that the government take responsibility for their legislative agenda and be accountable to the electorate who is loudly and clearly telling them that they are not happy with the legislation in its current form. It is imperative that the government take the feedback given to the committee and come back to the Parliament with amendments that address these concerns. For the government to push ahead without a single amendment and at such haste really paints a picture of a tin-ear approach to the many submissions received by the committee and, in turn, the many suggestions from the sector as to how this legislation can be improved. Instead, this government and this minister has deferred responsibility and shown that this government is not proactive in their engagement with the sector. The government has spoken of extensive consultation being undertaken. I believe the number given was around 1,000 people. But consultation should not be about volume. It should be about meaningful engagement. Based on feedback given from stakeholders and, quite frankly, what we are witnessing play out before us now, with the government trying to ram legislation through without bringing amendments based on feedback heard from the Select Committee, this government seems to be adopting a tin-ear approach, an approach of we know best. I think one of the key issues which highlights the government's tin-ear approach best is the retention of safety as the paramount principle. It has been apparent throughout the Select Committee process that the child protection sector is at odds with the government on one of the key founding principles of this legislation, that the safety of the child be the paramount consideration. It has been abundantly clear that the sector largely disagrees with the adoption of safety, as is for the most part in support of the best interests of the child being the paramount principle. It strikes me as unusual that the government would adopt an approach that appears to be contradictory to the views of the sector. What is important to note is that the best interests includes a child or young person's safety as one of the core rights that should guide all assessments of best interests. Keeping a child or young person safe is always in their best interests. The best interest principle does not sit in opposition to the principle of safety. Based on feedback received, safety as the paramount consideration results in a one-dimensional application of decision-making, rather than a holistic framework that considers safety amongst emotional needs, developmental needs, cultural identity, long-term outcomes, amongst other things. It has been said that the current framework is purposefully intended to create an unfettered focus on safety. This is not the full picture in how we grow our children, and is not fair to children and young people in care that they have to live under that framework through no fault of their own. We heard about what safety as the paramount principle means in reality. And Mr. Acting President, in reality, it means that children are unable to go on play dates because their friends' parents are sick and tired of going through police checks. In reality, it means children couldn't go to the school trip to Canberra with their peers. In reality, safety means that children are being told that they have to stand out from their class photo on school picture day. And I want to share with this chamber exactly how it was put to the committee by The Guardian, because quite frankly, I cannot paint this picture any better than she has. So please bear with me. The Guardian said, and I quote, "I have children calling me, and this is the one that gets me. Crying because they have to stand next to the photographer on school photo day because it's not safe, according to their social worker, for them to be in the school photo, despite there being no assessed safety risks. Those embarrassing school photos are a rite of passage for every person. We look at them and we laugh at our hair and how times have changed. Imagine, just for a second, what it would feel like if your whole class is up there and you are standing there next to the photographer and all of the kids are looking at you and the photographer. They know that you are that kid in care. They know that stuff has happened to you. Also, you are looking back at them. You know that you're not worthy of a photo, or at least that's what you are telling yourself. You have no photographic memory available to you about your experiences at school. You won't even remember that one teacher who gave you a fair go. So these are the very real things that safety clause has put into play that we must address, because it has very real impacts for children and they are missing out on life opportunities because of that." End quote. What has been abundantly clear throughout the committee process is that some issues within the child protection system stem from the legislation, but other issues stem from issues of either culture within the department or issues with practical application of procedures. Ultimately, though, the person who suffers as a result of these issues is the young person. The committee heard that often appointments or referrals for children in state care are not obtained in a timely manner or are not pursued at all, despite recommendations or requests that this occurs. The committee was told that where multiple services or assessments are required or recommended, as is often the case when a child first enters out of home care, the department may only support access to one service initially, and that these delays or refusals led to carers seeking seeking out services through private channels and paying out of pocket for medications, appointments and assessments without reimbursement from the DCP. Where reimbursements are provided, carers can experience significant delays in receiving them. The committee also concerningly heard that sometimes services are not deemed necessary or appropriate according to the Department for Child Protection's determination, even if this is contrary to the views of service providers, medical professionals, school staff and the carer. One example given to the committee was psychology support being recommended by a service provider working with the child. The department has deemed it not necessary or appropriate. The Parliament was told that these decisions are not made in partnership or in consultation with the care team and could even be made by a DCP psychologist who has not met with the child or young person. The committee was informed of cases where access to services have been denied based on lack of funding. These decisions are not limited to decisions regarding health or education. One example given with funding being denied was classroom support, such as an education support officer. The Parliament was also told that despite no change in the child or young person's support needs, funding is denied or considerably reduced due to funding restrictions. Mr. Acting President, these are but a couple of examples that were shared with the committee. Whether it is an issue of legislation, of policy or procedure or application, it is ultimately the child and young person who misses out and suffers. Some of the other areas the sector would like to see change within the legislation before us that the committee and we as an opposition have heard about, but to be quite frank, Mr. Acting President, this doesn't even scratch the surface of the many issues that have been identified. A lack of an independent complaints process, inconsistent application of the significant harm threshold, expanding and amplifying active efforts, prioritising and creating stronger provisions for reunification of families, establishing firm principles to prioritise family-based placements for all children and young people in care, bringing external oversight to decisions about children's contact with their family and other important people by making these decisions judicially reviewable, mandating referrals to family group conferencing, placing the decision-making about whether to participate in the hands of family in conjunction with an independent coordinator, prioritising and scaffolding early intervention and prevention pathways over statutory removal responses, requiring family group conferencing be offered to all families to promote family-led decision-making, family preservation and preventing children from entering care, supported by intensive family support to enact decision-making, lacking recognition of informal kinship carers. Mr. Acting Chair, this does not even begin to touch the surface of things that have been requested to be amended within the legislation before us today by the sector. We call on the Minister for Child Protection and the government to pause its plans to forge ahead with this bill. We call on them to go away and to consider the many, many suggestions of stakeholders and to come back to the Parliament with some considered amendments that they have consulted on. As an opposition, we have consulted broadly on this legislation and have heard from most stakeholders that they do not want this bill to pass in its current form. The ball is in the government's court to consider the vast number of amendments that are being called for to be made by the sector. It's not every day that we get this opportunity, and we should make the absolute most of it. In closing, Mr. Acting Chair, I'd like to share a couple of quotes with the chamber. Quote, this bill as it stands risks overburdening an already strained child protection system by failing to address systemic issues like resource shortages, high caseloads and underfunded support services. I urge this committee to pause and engage in deeper consultation, ensuring this legislation is not just a reaction to current crises or a way to satisfy small interest groups by the substantial evidence-based framework that looks to the future. Without this foundation, the reform risks being ineffective, inconsistent and detrimental to children and families, end quote. Another quote, to put it bluntly and give you an analogy, I believe It is an appeasement bill aimed at oiling squeaky wheels, patching punctured tyres, and trying to click over 300,000 kilometre mark on an old Holden that hasn't been serviced in decades. My assessment of this bill is that at a practical level, it is confusing. It sends mixed messages. With those charged to enact it, it relegates children and young people to being sidelined in a range of arenas as they sit and watch those with a vested interest argue about what should be done to them. All of this is done with no real requirement to engage and prioritise children's feelings, thoughts and perspectives. There are statements about the importance of voice and reasonably taking steps to hear them, but in the same breath, there are actual obligations to include children in their own life, and their existence has been taken out of the legislation, end quote. Finally, Acting Chair, I leave the chamber with the words of Belinda Valentine, a name that everyone in this chamber should know. This bill does not do enough to protect the next Chloe. My question to you is simple. Will this bill actually protect children like Chloe, or is it just more empty words? The overwhelming feedback is the latter. What will you do to help protect children today? And when will we get serious about a community education campaign and recognise the invaluable point of reference that lived experience brings to the table? Chloe would have turned 18 this year. She should have had a happy childhood and a full life. Instead, she was left in danger and lived only 4 short years. Don't let her death and others like hers be in vain.